Let me just expand a few abbreviations to you. So the next time your doctor uses this abbreviation, you know what they are talking about. First off is something called urine RE, by which we mean urine routine, where we just put the urine sample under a microscope and look for pus cell, look for blood. This is the commonest test that we order. The second is called a urine culture. CNS stands for culture and sensitivity, when we suspect an infection which requires antibiotics. Then in this USG is nothing but what's called a scan. And in scan, when we ask for a TDS, it's a transvaginal scan, which we ask only sexually active women to do, because the probe is put transvaginally, painlessly. And this, because the probe is much nearer to the organs like the uterus and the bladder, we get much more clarity of what's happening there with a TDS. And the difference between a sonomammogram and a plain mammogram is sono stands for ultrasound. So if they're going to do a scan of your breast, that's sonomammogram, usually recommended if you're still having your periods. Mammogram is X-ray of the breast, which we recommend after your periods have stopped. The last two, UFM stands for uroflowmetry, if you have a issue with passing urine, and UDS is urodynamics, which we want, if you want to test the pressure in your bladder and urethra, that's what we do. Thank you for attending my class today. Hope you didn't sleep.